9 Eye problems caused by diabetes. Subscribe to our channel for weekly updates on eye health. Thank you. Diabetes is one of the major causes of blindness. About 1 in 3 diabetic patients older than 40 years have some changes in their eyes related to high blood sugar. 1. Subconjunctival hemorrhage. Conjunctiva is the translucent, lax membrane covering the white part of the eye. The blood vessels under the conjunctiva become weak and prone to rupture as a result of poorly managed blood sugar. Blood builds up under the conjunctiva after rupturing, giving the unsettling appearance of a bloodshot eye. 2. Diabetic retinopathy. Due to increased blood glucose, the walls of the retinal arteries carrying blood to the retina weaken. As a result, the vessels begin to leak, which causes hemorrhages and swelling within the layers of the retina. The term for this is diabetic retinopathy. The severe types of diabetic retinopathy may require laser procedures and/or anti-VEGF injections. Some may even need vitreoretinal surgery. 3. Diabetic macular edema, DME. As a result of weak retinal vessels, fluid leaks around the macula, causing swelling and serious vision loss. 4. Recurrent eyelid swelling. A hordeolum, also known as stye, is swelling of the lids caused by an infection, while a chalazion is inflammation of the eyelids that is not infectious. Patients who suffer from long-term illnesses like diabetes, seborrheic dermatitis, and high serum lipid levels are at higher risk. 5. Cataract. The most common cause of blindness and one of the main factors contributing to visual impairment in diabetic patients is the cataract. According to reports, patients with DM have a 5 times greater chance of developing cataracts, especially when they are young. 6. Post-cataract surgery complications. First, cystoid macular edema. It is common to observe postoperative macular edema following cataract surgery. However, compared to the general population, patients with diabetes experience a more extended recovery period, a need for medication, and close monitoring of their condition. Second, posterior capsular opacification or PCO. The opacity that develops behind the intraocular lens implant is referred to as PCO, and is also known as secondary cataract or after cataract. According to some studies, PCO is more likely to develop in diabetic patients and become more severe than in non-diabetic patients. Third, corneal decompensation. After cataract surgery, corneal endothelial cell damage and persistent corneal edema are known to be more common in diabetic patients. Therefore, specular microscopy is used to evaluate diabetic patients, and all intraoperative precautions are taken. Fourth, increased inflammation. Severe iritis, sticking of the iris to the artificial lens, and deposition of pigmented precipitates on the intraocular lens, are also more frequently seen in diabetic patients. 7. Recurrent corneal erosions. As the patient's age and duration of diabetes increase, corneal epithelial abnormalities and erosions become more prevalent because of reduced corneal sensitivity. 8. Cranial nerve palsy. In diabetic patients, ophthalmoplegia is a form of microvascular nerve palsy of cranial nerves 3rd, 4th, and 6th, causing the weakening of eye muscles and restricted eye movements. 9. Primary open-angle glaucoma. The Blue Mountains Eye Study Australia suggests that there is a true connection between diabetes and primary open-angle glaucoma through unknown mechanisms. Diabetes is known to be an important risk factor for primary open-angle glaucoma. Uncontrolled blood sugar levels from diabetes can cause serious eye issues that can lead to visual loss and even blindness. It's critical to keep your blood sugar under control with a healthy diet, regular health checkups, and prescription medications, as directed by your doctor.